This is Cedarcrest Hospital, Victoria Island, Lagos. Well, world-class care meets a total commitment to wellness.
Welcome to Cedarcrest Hospital Lagos. Hi, good afternoon. My name is Ogochukwu, aka lead pharmacist, Cedarcrest Hospital Lagos.
Amazing. Ogochukwu, can you tell me what it means to you being a pharmacist here at Cedarcrest Hospital, considering today is World Pharmacist Day?
Today, I'm celebrating World Pharmacist Day, and it means three things to me. So, which is recognition, awareness, and empowerment. I'll say recognition because pharmacists are actually being recognized for the hard work and dedication they put into their work every day. And then awareness, people actually being aware of the roles and responsibilities of pharmacists, finally. And then empowerment, pharmacists are taking more roles in terms of policy making, in terms of decision making, and every other thing that has to do with healthcare. So those are the three things I'm actually really proud about being a pharmacist today.
Perfect.
Yeah.
Right. Can you show us your pharmacy?
All right. Okay, please come along. Yeah, so this is the pharmacy department.
All right.
So yes.
Perfect. Can we go in?
Sure, please come along. Please come inside. So the pharmacy is actually working.
I know you work with doctors and nurses every single day. So how do you make sure your medications are accurate as you communicate with the doctors and nurses?
We have something we call clinical rounds, which we do every single morning, and then it involves doctors, nurses, and every other health professional. So what we do here is basically to discuss about the patient, we share knowledge about this patient, and then review to coordinate care about this particular patient.
Good
afternoon.
All right, I can see that this is the X-ray department here at Cedarcrest.
Yes, sir.
Can I please get your name?
Okay, my name is Adam Gabriel.
That's fantastic. Adam, what is this machine used for here?
Okay, this is X-ray machine for X-ray.
Okay, and how does it work?
Okay, for instance, this is the couch table. Then that's the bulking for chest stand.
All right, and can this only be used for only chest X-ray, or other parts of the X-ray can be done here?
Yes, chest X-ray is done here. Skull also is done here.
Okay.
Then some extremities too can be done here, like the upper and lower too can be done here.
Sounds good. How about this one? How does it actually operate?
Okay. Like I said earlier, this is the table couch.
Okay.
So spine cases are done here.
Oh, I see.
Yes.
So what inspired the founding vision behind Cedarcrest Hospital?
Well, that's interesting, really. And I think I will extend the answer not just to Cedarcrest Lagos, but to Cedarcrest Hospital as a group. And at the time, it was clear that orthopedics and trauma care only existed in the three national orthopedic hospitals, and to a lesser extent, you might argue, in the teaching hospitals. But there was really no intentional, dedicated focus of orthopedics and trauma care as a specialty in the private sector. And that was obviously a gap. And that was the initial driving force to provide orthopedic care at the topmost level in terms of quality, in terms of complexity, in terms of all the indices. And so that was where it started from, and very quickly it grew to become a multi-specialty hospital, which had been run at the flagship hospital in Abuja for almost a couple of decades now. And it was, one could say, the success of that then necessitated having a Lagos footprint. And this is the Lagos footprint. I mean, there had been other addresses in Lagos, but where we are now is the Lagos hospital, as I would say. It's not rented, not leased, but a purpose-built hospital. So that, I would say, is the history of Cedarcrest Hospital as a group and in Lagos. Thank you.
You are welcome to the laboratory department at Cedarcrest Hospital.
Thank you so much, Dr. Akin Oluwole, for having us here today at Cedarcrest Hospital. Can you please introduce yourself?
Thanks. It's nice to have you guys around. I'm
Thank you,
Akin Oluwole. As you know, I'm the medical director for Cedarcrest Hospital in Lagos. I'm also a consultant vascular surgeon based in the United Kingdom. I do come here from time to time. So it's a pleasure having you.
Okay, perfect. I just have a couple of questions to ask you. Is that okay?
Yeah, absolutely.
All right, perfect. All right, the first question is, we're just going to go straight to what really entices you. What specialties does Cedarcrest excel in, and what's the importance to the patient and also to the hospital as well?
Okay, so Cedarcrest Hospital is a multi-specialty hospital. We cater for a wide range of specialties from internal medicine, gynecology, orthopedic, general surgery, vascular surgery. But what we're well known for really is orthopedics. Okay. We are a tertiary referral center for orthopedic surgery. We do all sorts of orthopedics, arthroplasties, trauma, spines, and we are also into neurosurgery as well. We're one of the few accredited centers in the country that train emergency room doctors. But from my point of view, vascular surgery is something that is unique for us. As far as I know, there are not many centers in the country that are purely uniquely trained vascular surgery centers. We're the only one I know. I stand to be corrected on that, but I'm sure we are. So yes, that's something we're really unique for.
Absolutely, that's good. All right, so the next question is, how do you ensure your doctors and your nurses stay updated with global medical best practices?
Yeah, that's a very good question. I mean, obviously, staying updated with the global practices is very important for patient safety, for quality care, and also for professional development. So One of the things we are very good at, where a lot of our consultants and professionals are based abroad. So we have something called MDT, multidisciplinary meeting, where we discuss complex cases, even for most cases actually, where you get multi-specialist opinion, and we bring all that together and we formulate a care plan for patients. So that's something we do. We're also very good at continuing medical education. We have regular Thursday weekly training for nurses, for doctors. We send our doctors abroad for training for a few weeks to get specialist training and experience as well. So that all those together keep things going for us. So we're more in tune and more updated with current practices. And that helps our patients.
That's amazing. Also, something that speaks to mind is how does Cedarcrest Hospital bridge that gap of medical tourism? We hear that a lot on the news, and we're seeing this facility and the amount of investments and the amount of expertise.
Yes.
One-on-one doctors that can stand part to part with any institution in the world. How do you bridge that gap?
It's very good. Actually, very good question. Recently, I'll give you an example. One of my colleagues in London saw a Nigerian that came for vascular surgery, and he told him, "No, you don't need to come here. Go to Nigeria. We have a vascular surgeon in Nigeria." So it's difficult, but over the years, we've been able to get the word around for people to know that what you get there, you can easily get here. It's cheaper, you are home, you're in your own environment, you have specialists that you're probably going to see there, or who are even training the people that you're going to see there. So over time, it is getting better. It will take some time, but people are beginning to realize that a lot of specialist care that they go abroad for, they're here. Not just at Cedarcrest Hospital, but in other hospitals as well.
How would you describe your experience over the years? I mean, you've studied in the UK, in Nigeria, you've gone back and forth. You're one of the renowned people in the industry. How do you, first of all, see your role as a major player, and also how do you advise the younger ones? Because we need more surgeons in this kind of spaces, but I know everybody wants to travel abroad and don't want to come back. So what's your word for them, and how can they bring that experience back to hospitals like Cedarcrest and the rest of the other hospitals in Nigeria?
Well, maybe I should tell them about reverse japa. But to be honest, I mean, I trained in Nigeria. My first degree is in Nigeria and Lagos, and I went to the United Kingdom and other countries as well.
Yes, sir.
Look, in Nigeria currently, the training is not as good as it should be. It is getting better. People are getting to know more, people are getting more exposed and enlightened. So I won't begrudge anybody who wants to go abroad for some time to train. But home is always home. There's always needs, there's always facilities here, there's always things for people to do. So my advice for the younger ones is that, yes, get your training as much as you can. But this is where you practice. This is where you actually excel. This is where you can expose yourself. For me personally, yes, I've been in the United Kingdom for quite some time, but every time I come here, I get that pleasure, I get that satisfaction. Let me give you an instance. There was a lady that was seen in another hospital here in Lagos. They were going to take her leg off above the knee. Her daughter, who is in UK, searched online and saw my name. They brought her here. I saw the lady today, she's walking. Also is healed. So things that gives you that pleasure, gives you the drive, the motivation to say that I want to do this more. And that's one of the things that drives me.
Okay. Final question, just to close it off. How would you describe Cedarcrest Hospital in a few words? You're in Lagos, you're in Abuja, in other parts of the country, and the name, the brand, the patient care centric, but most importantly, the science-based sort of ways in which you attack problems.
Yes.
It's really outstanding, and it shines a light in Nigeria and across Africa and the world. So how would you just describe this institution?
It's I think one word or one sentence is a center of excellence. And one thing about any establishment or anything you do, it bears a hallmark of the visionary. I think one thing I can say about Cedarcrest is that the visionary group CEO, Dr. Ogedegbe, is a driver. It drives the passion. It drives the mission. It drives what's going on. It wants excellence, even when it may think it's impossible. It drives that. And that's what's been driving us for the last 15, 16 years. Wanting us to achieve more, wanting us to get better, wanting us to be able to provide what attains overseas here in Nigeria. And that's one of the things we've managed to do. So, yeah, Center of Excellence, driven hospital, and we want to stop tourism. We don't want to reverse it. We actually want to stop medical tourism and provide stuff for people here.
That's a big statement. You heard it from the medical director himself. Thank you so much, Dr. Akin Oluwole. It was nice having you. Thank you so much.
Pleasure
sir.
having you.
Thank you, sir. Yeah.